If you have a stiff, painful shoulder, how do you know if it's adhesive capsulitis, a frozen shoulder, and what do you do about it if it is? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, frozen shoulder is a very common condition that orthopedic surgeons see, especially in older patients. And there's typically two types. One is what's called or what's considered a primary adhesive capsulitis, where the shoulder just gradually loses range of motion with no underlying injury or traumatic event. It just gradually, for whatever reason, you see this more in diabetics, but it can affect lots of different people, where gradually the shoulder range of motion just gradually gets less and less. It gets more painful as you try to use it in certain directions. And then all of a sudden that capsule gets really tight and you really can't move it. It can also happen secondary to an injury inside your shoulder. Rotator cuff tears would be a common one, where the rotator cuff tear initiates a process of pain that then causes the patient to lose range of motion. I'm sort of dumbing this down a little bit, and not to be condescending or anything, but just make it as simple as possible. There's a lot of theories and etiologies of adhesive capsulitis, but that's generally what you sort of see as an orthopedic surgeon. Often, this is something that can get better without surgery. Working with a physical therapist to really work on stretching out that shoulder capsule and making range of motion easier can be helpful. Sometimes steroid injections into the shoulder can help loosen up that capsule to augment that, just basically give you a little bit more range of motion. The capsule loosens up so that physical therapy can be more effective. So those two frequently you can see together. Sometimes, though, that may not be enough to get it better. If there's an underlying rotator cuff tear or something like that, then it may be partially involved in addressing that particular injury. But if it turns out to just be a frozen shoulder with no other underlying issues involved, some people will do a manipulation under anesthesia, where they, in a surgery center or somewhere in a hospital, somewhere where they can do a procedure where they basically make you sleepy, and then the surgeon moves your shoulder around to break up that capsule a little bit and help get range of motion back. And then you would do a lot of work with physical therapy after that procedure to keep the increased range of motion that they got during the procedure. Sometimes it's actually scoping the shoulder and releasing adhesions and releasing the capsule to free up range of motion as well. There's a lot of differences and nuances, so it's important to talk to your doctor, to your orthopedic surgeon, and see if that's what the issue is, and then if so, what the best initial and long-term treatments for that would be. Now, I'd love to hear your experience with your shoulder injury, and maybe it's a frozen shoulder, so leave those in the comments below. Just understand, I can't offer you specific medical advice there, but I do try to collect the topics in those questions for future videos. Make sure to subscribe to my channel, click the bell to be notified when I release a new video on one of those topics, or when I start a new live stream like my Ask Dr. Geier live shows. If you have shoulder pain, knee, hip, or any other joint, you want to get significantly better in the next 30 days without cortisone shots or surgery, you can learn more about working with me in the description below this video. Thanks so much for watching, and I really look forward to helping you feel, look, and perform better than ever.